Welcome to the New River Valley Recovery Ecosystems presentation of what you need to know about Virginia's Opioid Abatement Authority. The Opioid Abatement Authority of Virginia was established by the General Assembly in 2021 as an independent entity to abate and remediate the opioid epidemic in the Commonwealth through financial support from the Virginia Opioid Abatement Fund in the form of grants, donations, or other assistance to treat, prevent, and reduce opioid use disorder and the misuse of opioids in Virginia. The Virginia Opioid Abatement Authority, or OAA, as we'll refer to them forward, serves to build partnerships between Virginia's cities and counties, state agencies, and providers of service in order to assist individuals suffering from opioid use disorder and co-occurring substance use and mental illness. These partnerships address the full range of services, providing education about substance use, prevention, treatment, recovery, and harm reduction supports. Financial assistance offered through the OAA consists of settlement funds paid to Virginia by prescription opioid manufacturers and companies in the prescription of opioid distribution network. The 11-member OAA board membership is made up of designees and governor appointments from various agencies and specified populations and sectors of business, healthcare, and impacted population. The next two slides give the structure of these designees and appointments. You'll note that several come from governmental agencies and governmental committees, as noted on this first slide. And in this second slide, you'll see that there are representatives of organizations and agencies that are directly on the front line of providing services, and the final addition to the board is a peer representative, which is a person who has lived experience in addiction and recovery. The OAA board meets at least annually to review recommendations from staff and committees regarding policy, funding, and programmatic elements. The OAA Grants Committee meets at least quarterly to review grant applications, amendments to applications, grant renewals, and address funding of these elements. The OAA staff works year-round to support and respond to information requests, grant application support, and implementation, as well as questions, and they support the board and the committees. They also provide online and in-person training to support funding applications, programming, and general education about opioid abatement. Their website offers links to these resources and are definitely worth perusing if you're considering programming in these areas. These are the OAA funding regions that follow the DBHDS regions of Virginia. The New River Valley is in Region 3, Southwest, in purple. Each region is allocated OAA funding through the state based on population and opioid impact. The overarching goals of Virginia's OAA is to build partnerships and sustain impact on opioid use, treatment, and prevention of addiction. This funding is targeted at direct services to address current and critical treatment and recovery needs of people and communities struggling with addiction. It also supports the range of services and underlying supports necessary to prevent use, as well as to sustain life and reduce harm for those not yet on a recovery journey. The funding that supports the OAA work in Virginia is from legal settlements with opioid manufacturers, distributors, and promoters. All Virginia OAA funds are allocated to counties and cities for use to address opioid abatement. Direct distribution to cities and counties from the settlement administrator is 30% of the overall total of money coming into the state. It is important to note that some portions of the settlement are distributed directly to Virginia cities and counties. These payments are distributed directly to the cities and the counties from the settlement administrator without flowing through OAA. It's important for city and county officials to be fully informed about the allowable uses and limitations of these funds as specified in the actual settlement agreement. Um, for instance, distribution settlements were in two payments in some cases, and in some cities they came as one payment. Virginia's cities and counties will continue to receive annual payments from distributor settlements through the year 2038. Similarly, in 2022, Janssen provided its first payment to Virginia cities and counties. The total Janssen payout will take 10 years as opposed to 18 years with the distributors, but Janssen is providing first 4 years payments all in the first year of 2022. This means cities and counties received one large payment from Janssen that covered 22, 23, 24, and 25 amounts. Cities and counties will then resume receiving single-year payments from Janssen in and or about on June 1 each year from 2026 through 2031. This is important to pay attention to since these settlement funds do not come through the state. Another breakdown of the Virginia settlement funds is direct distribution to the Commonwealth, which is 15% of the total. Funds will also be direct distributed to the Commonwealth of Virginia for appropriation by the Governor and the General Assembly. And then the funding that is distributed through OAA is 55% of the total. Funds that are deposited to the Opioid Abatement Fund will be distributed as noted in the chart. All funds provided by the authority to cities and counties and to state agencies must be used to abate and remediate the opioid epidemic. There's information about settlements and agreements and the statute at their website. In general, most efforts to prevent, treat, and support recovery from opioid use disorder and co-occurring addictions and mental illness are covered. Cities and counties can expand existing programs or implement new programs, but no supplanting of existing expenditures allowed. Distribution to cities and counties, there's an additional 15% of OAA funds within this 55%. Each city and county in Virginia is eligible to receive a specific amount of OAA funding in accordance with the state's MOU. In order to obtain these funds, the city or county will be required to agree to certain terms and conditions and must apply to the OAA for approval. There's also another 35% of OAA fundings that will be awarded for projects involving two or more counties. These are cooperative funds. And a minimum of 15% will be allocated to participating cities and counties, and at least 35% will be provided for cooperative projects. Lastly, there's a distribution to state agencies, 15% of OAA funds to state agencies through separate process for opioid abatement remediation. And the unrestricted funds, that's 35% of the OAA funds that come through the state. The unrestricted portion of the opioid abatement fund is designated to allow the board the ability to support opioid abatement remediation projects in other ways, such as the gold standard and one-time allocation funding. I'm going to go through specifically each one of these distributed funds in the gray section on the following slides. First, let me show you that this is the overall financial plan for recommended grant awards in this past year. Just letting you know how it gets distributed throughout the state. As you'll note, Region 3 received 37% of the funding in this last year. As we noted in the chart, there are 4 different types of funding through OAA: direct, individual, gold standard, and cooperative partnership. The following slides will walk through each one of these. Cities and counties will continue to receive annual payments directly from distributor settlements through 2038 from different settlements. Direct funds do not come through the state and can appear as either a wire transfer or check to the localities. Government members of the New River Valley recovery ecosystem use direct funds for matching our cooperative program. Individual funds, this is funding that is set aside at the state level for each county and city based on population and impact of opioids on the community. While a locality does not need to compete for these funds, they must request them from the state for specific uses and programs and expend the requested amount within the fiscal year they are allocated. If unspent, these funds may be required to be refunded to the state for other uses within the OAA program. Gold standard incentives. This is incentive funding to encourage localities to utilize all of their OAA funding to support opioid abatement. In the New River Valley, all localities have committed to this standard. Cooperative partnership funds. This is where the current 5-year funding program for the New River Valley Recovery Ecosystem Program was built. As noted, it is a competitive process and requires cooperation between at least 2 jurisdictions, cities and counties, to seek this funding. It is allocated competitively across the state and can be matched by other OAA funding, such as the settlement fundings noted on this slide. These are eligible amounts, but it is not required to use OAA funding to match. You can use other federal, state, or local funding in matching when applying for cooperative funding programs. Cooperative partnership goals. In considering potential awards, the OAA board is directed by the statute to prioritize programs or organizations with an established record of success. These are expanding on existing programs that are already successful in areas and or at the state level. Programs in communities with a high incident of opioid use disorder or opioid death, targeting populations that are most at risk, or programs in historically disadvantaged, economically disadvantaged communities. These are areas where there's high rates of poverty and other impacts such as job loss. What is critical when looking at a cooperative partnership project is ask questions like, will it make a difference? And does it get to the root of the issues? Will it set the community, organization, or government on the right path? Below is the timeline for a cooperative grant program. In October, the portal for cooperative grants opens. Usually that's about mid-October. They haven't set the date for this year yet. All applications deadlines are April 1, so they can be submitted anytime up and through April 1st. In late April, usually the staff reaches out with questions or clarifications about the proposal to make adjustments prior to their recommendations. In early May, the OA staff prepares recommendations for awards to the grants committee. They make suggestions of things that should be awarded or denied or modified to the staff. In late May and early June, the OA grants committee meets to select proposals for award and to review all proposals prior to sending it up to the full board. Each county and city are required to create a profile and log in to the OA portal. Everyone in the New River Valley has already completed this process. This is where information about programming is shared by staff. It's where you can ask questions to staff. It's also the process by which localities and regional activity can apply for both individual and cooperative funding. Additionally, this is where we track information about funding that is spent through individual, goal, direct, and cooperative funding, and also how we submit reports and questions to both staff and the committees. While many programs are eligible for funding, OAA has created a list of approved uses for localities to consider when determining work they want to do to address opioid abatement. The following 3 slides are a list from their website. Noted on the website, the OAA may make grants from the fund that support efforts to treat, prevent, or reduce opioid use or the misuse of opioids or otherwise abate or remediate the opioid epidemic. Such efforts include, but are not limited to, the following. Obviously, there's a lot of focus on treatment and people in recovery, providing connections for those and people who have co-occurring issues as well around opioid use disorder. There is also a desire to build services that can support people on the front lines, such as law enforcement and other people doing treatment and support of people in recovery. A particular population that the Virginia Opioid Abatement Authority targets is the needs of pregnant and or parenting women. This is to address and break the family cycle of addiction. And other programs have to do with prevention and discouraging the overprescription of opioids and to discourage and prevent the misuse of opioids. These can be with individuals as well as with providers or distributors of opioids. Also, to reduce opioid deaths, this has to do a lot with naloxone and distribution. Also, to provide comprehensive resources for people seeking detox. Access to care and access to treatment is a key to all of the work that goes on in addressing opioid use disorder. Things that OAA funding may not be used for is supplanting is a key one. You may not use this funding to fund programming that is already being funded through another source, be it general funds or another grant, unless the program that that you're doing is no longer funded, such as the grant is unavailable or general funds are no longer allowed to be used for that source. These are things that we would want to run up the chain with the OAA staff prior to submission. Also, localities are not allowed to use this funding for indirect costs. With the background of the Virginia Opioid Abatement Authority requirements covered, we wanted to cover a little bit about the New River Valley Cooperative proposal that was built to build an integrated program to address opioid abatement from prevention to harm reduction. These are some of the elements specifically funded through partners and localities to support the regional ecosystem. When this proposal was submitted in fiscal year 2024, there was a desire to address everything from prevention through harm reduction, and these are some of the elements that we developed in that 5-year proposal to address that. Um, it included everything from treatment, harm reduction, and recovery to service providers, as well as assessment of what additional or unknown needs might be for our population. There was also the idea to create and promote supportive factors to address remediation of underlying trauma and adverse experiences that create the risk of substance use disorder, and education and facts to address stigma around addiction and recovery. A key to the whole work of the New River Valley recovery ecosystem is to value the lived experience of people who are living with opioid use disorder and in recovery, because they are our experts who can help us understand what truly is needed to create a recovery ecosystem in the New River Valley. This 5-year program, begun in FY24, laid the basis for the New River Valley recovery ecosystem. Additional partners have been invited into funding over the course of the first 2 years, and there are specific funded elements that will continue through year 5 of this project. However, the New River Valley recovery ecosystem was always intended to sustain the work beyond this initial funding. To keep the project nestled but specifically identified within the overarching ecosystem model, the Montgomery County Fiscal Agent driven foundational work of this work will be referred to as the Recovery Ecosystem Project Montgomery County, or REP-MC, moving forward. Highlights of what's coming forward in the FY26 program through this funding includes expansion of transportation to support recovery work and pro-social opportunities, peer center development expansion in Floyd, Giles, and Pulaski, broad school engagement to support prevention and access to services, and continued enhancement of recovery court programming and supports. These two slides, the two following slides, share the scope of this foundational funding program in the New River Valley through the list of partners and their programmatic focus. New River Valley Community Services is our primary service provider and covers everything from treatment to prevention. New River Health District is our focus in harm reduction. Community Health Center, the New River Valley, is a critical treatment and peer support function. New River Community College is doing peer support for students and staff. The New River Valley Agency on Aging provides transportation referral and travel training. New River Community Action does work in our pregnant and nursing mothers and peer support for housing and landlord engagement. Giles Health and Family is focused on transportation and providing services related to transportation. Instill Mindfulness has a peer facility staffing and peer support. Giles County is developing the Recovery Fitness Center with peer and other wraparound services. And Pulaski County has the Recovery and Prevention Director and Recovery Facility staffing. Because the Regional Commission has been a convener of several elements of the New River Valley Recovery Ecosystem, as well as the initial cooperative application to OAA, we wanted to call out the specific role this organization plays in this work. While not a treatment, recovery, or harm reduction service provider, the Commission supports the integration of these services and organizational relationship building necessary to strengthen the ecosystem. As part of the effort, the community health team is tasked with several administrative and facilitating roles for the FY 24-28 REP MC project. Specifically, the grants related to that grant, we provide facilitation of all the technical teams and leadership. We do research and evaluation of gaps in services and resources. We've been supportive of drafting of the renewal proposal and review and input. We provide prevention education, training, and resources to K-12 and community partners in the area of trauma basics and mental health first aid, as well as educational opportunities for prevention in the schools. We support the Peer Coalition logistics and engagement, provide outreach and anti-stigma campaign work and development, and execute that program. Provide performance and fiscal tracking to support the overall project. And we are provide fiscal agent support and reporting. We review all partner invoicing and draft support and drafting of supporting MOAs and operating agreements, particularly in the area of performance tracking. All partners, specifically those funded through the cooperative project REP MC, have agreements through memorandums of agreements to fully participate in supporting and building and sustaining of the ecosystem. While the MOAs call out fiscal and programmatic requirements, the partners have also agreed to participate in supporting the ecosystem model through technical team engagement, cooperative programming, and referral exploration. The next slides will dive deeper into how the New River Valley Recovery Ecosystem can enhance data and referral sharing, as well as to address changes in the performance measures tracking requirements through OAA.
There are several reasons why performance tracking is so important to this work. First and foremost, performance tracking is a required component of all OAA cooperative projects, as well as any projects that use localities' OAA individual, gold, or direct funds through the Gold Standard Agreement. All of the localities have adopted the Gold Standard. Beyond compliance, data helps us understand where resources and services are lacking in our region and how we can better address those needs. Data from the first 2 years of this project has already been used in local and statewide presentations and included in new grant applications. Additionally, we share data in our monthly OAA newsletter to highlight local and regional progress within the recovery ecosystem to stakeholders, government leaders, and the community. It's a valuable tool to tell our story and demonstrate the impact of our collective efforts in the New River Valley. How to choose which performance indicators to track. OAA provides a list of their key performance indicators, or KPIs. All OAA-funded projects must select at least one performance indicator to track throughout the fiscal year. The current list of KPIs that the Recovery Ecosystem Project is tracking were chosen in the first-year application of the cooperative project. Providers selected key performance indicators to track based on their funded activities and then projected 5-year outcomes of the data. These projections have been reviewed and updated each year during the renewal process and adjusted as needed. A list of all of the OAA KPIs can be found here. As you can see, the performance indicators are broken down into subcategories of prevention and awareness efforts, efforts directed towards pregnant or nursing women with substance use disorders, efforts directed toward children with substance use disorders, efforts directed toward individuals with SUD who are criminal justice involved, efforts directed toward adults with SUD who are not incarcerated or pregnant nursing, and harm reduction efforts. Originally, we were not permitted to submit personalized performance indicators. However, OAA has recently updated its guidelines to allow this. This is especially beneficial for our region as we can now officially submit data on metrics like transportation, something we have already been tracking and reporting internally for the last 2 years, and show the impact of these services and OAA funding on this key issue. These personalized key performance indicators are in green. And again, you are not required to track all of these. You choose the most relevant to your funded project. As a funded service provider, you will need to review these indicators and select which ones you'll track for fiscal year 26, along with a projected annual total for each. It's important to remember that selected KPIs must directly reflect your OAA funded project activities, and any data reported should include only services provided through the expansion, enhancement, or new components supported by OAA funding. Here's an example of what that looks like. If your locality was using OAA funding to establish a new overdose reversal program, then an acceptable performance measure would be number of overdoses reversed as a direct result of this new project. You would not be able to count the total number of overdoses reversed for the entire city or county. It must reflect only those overdoses that came from this new project. Now, if your locality already had an overdose reversal program and OAA funding was being used to expand or enhance this program, then an acceptable performance measure would be number of overdoses reversed as a direct result of the expanded or enhanced portion of this project. You would not be able to count the total number of overdoses reversed for the entire program if it was already existing. This guidance does change how we've been tracking performance numbers during the first 2 years of the Recovery Ecosystem Project, so I expect that the projected numbers will change for fiscal year 26 KPIs. To support this work, we are asking all service agency providers and funded county projects, including local match programming, to select which KPIs they will track beginning July 1 for fiscal year 26 and provide an estimated annual total for each. KPI data will be reported to the Regional Commission on a monthly or quarterly basis using either a Google Sheet or REDCap. REDCap is an online HIPAA-compliant tool designed to securely collect and manage data. All localities and service providers have signed a data sharing agreement with the Health Department for use of this tool. In addition, service providers may also wish to have data sharing agreements in place with their participants prior to using this tool, though it is not required. We currently have 2 survey tools available for providers in REDCap. The first tool is the aggregate survey, used to report on OAA-required KPIs. This survey can be completed the day of an event or used to enter data collected over a longer period of time. The date field at the top is flexible and does not need to match the exact service date. Next, you will choose your organization from the drop-down list. All funded service providers will be here. Let's choose Community Services, for example. Then, select your bucket under which the service you provided falls. These follow the OAA-provided KPI spreadsheet categories. Once you select, it will autofill underneath and show all the KPIs that fall under that bucket, and you will enter the number of individuals served. More than one bucket can be chosen at a time, and it will autofill in underneath. Once submitted, you will not have access to edit or change data in the aggregate survey. The second tool is the participant-specific survey, designed to track an individual's services and referrals throughout the recovery ecosystem. This survey uses a HIPAA-compliant unique identifier, which combines the first 2 letters of a person's first name, the last 2 letters of their last name, and their 2-digit birth year. All service partners will use the same identifier for each individual across the recovery ecosystem. This will allow better tracking of referrals and linkages, as well as only needing to collect demographic and usage information on the first visit to any partner within the ecosystem. For the first 2 years of the project, we used an individual survey that was accessed via a REDCap link and did not require a login. We are committed to making data tracking as smooth and streamlined as possible and are open to any suggestions that would make collecting data simpler. One such suggestion was implemented this year for fiscal year 26 and makes the individual survey editable, and service providers now have the ability to run reports and download data from the project. To use this feature and the individual survey, it requires each funded service provider to get a personalized REDCap login, and that can be requested with an email to Anna Champion. A full training demonstration of this tool is uploaded on the Recovery Ecosystem website. We also continue to explore the possibility of using a tool like Unite Us, that is an online program that has the potential to generate and capture referrals across our region with any signed-on service provider, allowing participants and providers to initiate the process. Be on the lookout for more to come on the potential use of Unite Us in our region. Thank you for watching, and if you have any questions, contact Holly Lesko or Anna Champion at the Regional Commission.